homes and businesses. A Homeland Security terrorism advisory warned.
Hello, everyone. Let's do 4K. Okay. Good, good afternoon, everyone. Welcome to Whitman-Walker Health's Community Department Instagram Live. I'm going to wait a few more seconds for people to jump on. I see a couple of my friends hopping on. Let's see if I can wave. Okay. Okie dokie. Let's see. Hello, everyone. Hello, everyone. Pardon the noise outside. There's tree removers outside. But hello, everyone. During the COVID-19 pandemic, Whitman-Walker's Health Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. For those of you who don't know, my name is Marshawn, pronouns he and she, and I work to bring educational Instagram lives to this space with Whitman-Walker Health's community health team. Today, we're going to get into some things, as we always do on these lives. We're actually going to discuss sex and holiday travel. I know a lot of people have been traveling due to the holidays. We've been in our hometowns. We've seen our hometown friends and our old hometown partners. And today we're going to talk about ways to protect yourself and just discuss a couple of things. According to CNN, more than 30 million people travel each year during the holiday seasons. And sexual activity is known to vary by season, with the increase of sexual intercourse and unsafe sex occurrences around the Christmas period, as I just said. Holidays not only provide great food and fun TikToks with your families and friends, but also an opportunity for increased sexual chemistry. The risk of developing an STI and having unprotected sex during the holidays is much greater than it would be at home, and the individual is 3 times more likely to acquire an STI. An estimated 2/3 of people, when they travel, do not use condoms or use them inconsistently, which, you guessed it, equals higher STI rates. Increased alcohol or drug use, freedom from the usual social restraints, and peer pressure are also other reasons attributed to the higher risk of developing an STI during the holidays. The CDC states about 1 in 3 travelers will have new sex partners while on a holiday trip. The excitement of being in another country, city, or location and meet new people may lead travelers to engage in risky behavior that can lead to sexually transmitted infections, better known as STIs. Those which include HIV, gonorrhea, syphilis, and chlamydia. Pause. For example, because I love examples, some people travel for sex tourism. Some people travel around the world specifically for sex. It's a real thing. Sex tourism is defined as travel planned specifically for the purpose of sex, generally to a country or locations where sex work is legal. STIs may occur without any symptoms, as you may or may not know, so you may not realize that you or your partner is infected. While most STIs are treatable, some can cause serious health problems if left untreated. For some, this may be new, like I said, but it may be a refresher to others, but I'm just going to share a couple of activities that put you in risk for STIs. One, having anal, vaginal, or oral sex without a condom. Two, having multiple sex partners. Three, having anonymous sex partners. And four, having sex while under the influence of drugs or alcohol, which can lower and result in greater sexual risk takings. I'm not here to scare anyone, so don't get on here thinking, oh, Marsha is trying to scare you. No, that's not what I'm here for. No judgment. If you had a sexual encounter during the holiday or traveled away from home, the Whitman-Walker Health Community Health Department team is here. Testing is highly encouraged as many STIs do not show any symptoms, but you still may have possibly been exposed. Some STIs won't cause symptoms for people, but they can still be transmitted. If you've had a new partner during the holidays, it is recommended that you be tested when you return home or at your earliest convenience. It is also recommended that you include the following tests: gonorrhea, syphilis, chlamydia, and HIV, as new numbers of new infections have increased greatly in the recent years. Basically, the Spark Note versions of everything that I'm saying, long story short, is that an increasing number of people are now traveling and having sex during the holidays, which exposes you to a different sexual network. If you found yourself swept away in an unexpected and unprotected holiday romance, you must put yourself and your health first. Let's scroll through the comments. So someone said, my brother, may you repeat those tests again? Of course. The Whitman Health Department, Community Health Department team recommends you getting tested for syphilis, gonorrhea, chlamydia, and HIV. Once again, chlamydia, syphilis, gonorrhea, and HIV. Let's make sure. And if you have any questions, definitely feel free to ask me. If you're not comfortable asking your question on the live, you have our number pinned below. You can DM us. You can, whatever works best for you. Let's see. Okay. Let's see. It doesn't look like we have any more questions. Well, thank you for taking the time to learn more about safe sex after the holidays with me, everyone who's joined. Before I go, I wouldn't be myself if I offer all of this information and then offer additional resources, of course. Just as a reminder about HIV and STI prevention and testing services available at Whitman-Walker Health. Learn more about our testing hours and locations at whitman-walker.org/testing. HIV and STI testing are available by appointment at Whitman-Walker's locations Southeast and Northwest. You can call us at the PIN number below to schedule a testing appointment, and be sure to check out our website and our Instagram for our most up-to-date hours. The Whitman-Walker locations are as follows. The Max Robinson Center, located in Southeast and Anacostia, is located at 2301 MLK Avenue Southeast. We also have our Northwest location located near Logan Circle on 14th Street, and that's 1525 14th Street Northwest. If you or your community organizations is interested in Whitman-Walker providing mobile health services in your neighborhood, such as testing, prevention tools such as PrEP or PEP, or to start treatment for HIV, you can contact us via email at mobilehealth@whitman-walker.org, or you can call the number we have pinned below. Before I go, I also want to remind everyone about the COVID-19, COVID-19 and their vaccines we have available. If you've already gotten vaccinated, congratulations. You've taken a really helpful, important step in preventing your loved ones, yourself, and your community from illnesses. Multiple variants have soared across the world, and it's totally understandable why you might not want to keep wearing your mask. I know it kind of bothers me as well, but the vaccine isn't 100% effective. More contagious variants are spreading, and there are few protocols in place to actually verify that folks around you are vaccinated. So stay alert. If you haven't been vaccinated and you're looking for an appointment, you've come to the right spot. Whitman-Walker Health has the COVID-19 vaccine available. Feel free to reach out to us at the PIN number below, or reach us at 202-207-2480 to make an appointment. Okay, if I get tested and vaccinated at the same time. Yes, you can totally schedule an appointment and get tested and vaccinated at the same time. We're also doing flu vaccinations as well. For DC residents, you can find out information around the COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov, or you can call the number 1-855-363-0333. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov, or by calling 855-634-6829. And last but not least, for Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov, or by calling 877-829-4682. If you still haven't been vaccinated and you're looking for an appointment, please continue to follow the CDC guidelines for wearing a mask, quarantining, social distancing, and the like. It's very important that you consider getting vaccinated, discuss COVID precautionary measures with those around you, and be mindful of masks. Keeping your distance, but especially when you do not know whether a person has been vaccinated or not. Now we're going to wrap it up with monkeypox. According to the CDC, there are more than 29,000 cases of monkeypox documented in the U.S. In DC, you can actually pre-register for a monkeypox vaccine appointment at preventmonkeypox.dc.gov. In DC, you can register as well at, Virginia is also working with local care providers to contact trace and identify those most in need of the monkeypox vaccine. Varying countries in Maryland are allowing residents to pre-register for the monkeypox vaccination, and the Maryland Health Department has just released a pre-registration system. Please visit your state's local health department for more information on how to register and get vaccinated against monkeypox. And let's just cruise through here one more time to make sure I haven't missed anything. Okay. If you have any questions, like I said, feel free to call us at the PIN number. You can DM us. You can DM me personally if you're not comfortable asking on this platform. But thanks, everyone, for joining us today. Remember to follow us on IG, Facebook, and Twitter at Whitman-Walker, and check out our website, www.whitman-walker.org, for the most up-to-date information on our services. For more COVID-19 resources and general Whitman-Walker services, please call us at the number we have pinned below at 202-797-4439. I know that number by heart. It's like my cell phone number. And be sure to follow some of our programs in our Whitman-Walker family at Real Talk DC _ and No Filter DC on Instagram. Thanks, everyone. Have a great Tuesday.